Hello everyone, my name is Lei from Henan Joint International Paediatric Urodynamic Laboratory for the affiliate hospital of Zhengzhou University, China. I'm very glad to be here to introduce my abstract. My speech title is Effect of overfilled bladder on uroflowmetry and post-operative residual of postoperative urethral stricture in children with hypospadias. This is my discourse, and I will introduce my abstract in the following 5 aspects. Uroflowmetry combat postoperative residual measurements is well known a useful tool in diagnosing bladder dysfunction and alternative obstruction. Recently, it has been used in evaluation of different types of urethral stricture. The patients was encouraged to drink more water and overfill the bladder, guaranteeing maximum word value to keep successful recording the uroflow curve in many hospitals. But the question emerged due to overfilled bladder is not natural and may change the bladder function artificially. Therefore, our study aims to investigate the effect of bladder overfill on uroflowmetry and PVR of postoperative urethral stricture in children with hypospadias. A total of 112 children aged 4 to 6 years with penile hypospadias were performed at one-stage urethroplasty involved in this study. Uroflowmetry and PVR measurements follow-up were performed at 3 to 6 months after urethroplasty. The patients was divided into 2 groups. Urethral stricture, dysuria with a 6F urethral probe unable to go through urethra, and no stricture group with no voiding difficulty and a 6F urethral probe can go through urethra easily. Each group consists of 2 subgroups, bladder overfill and no overfill group. The maximum uroflow rate, voided time, and voided volume, PVR, and uroflow curve shape were compared between different groups. This is our result. From this table, we can see that in urethral stricture group, a significant decrease in Qmax and an increase in VT and PVR compared to those with no bladder overfill were found. In children with no urethral stricture, a significant increase in Qmax, VT, and PVR compared to those with no bladder overfill were found. And from this table, the ratio of normal smooth uroflow curve decreased and the statistical curve increased significantly in all children with bladder overfill compared to those with no bladder overfill. This is an example. We can see the Qmax in the case of bladder overfill was significantly lower than that in the case of no bladder overfill, and the voided time was significantly prolonged. The results showed that overfilled bladder produced significant effects on results of uroflowmetry and PVR measurements. It induced a significant change in Qmax, VT, PVR, and the type of uroflow curve. The mechanism involved in this change is still unclear. However, overfilled bladder will induce significant bladder distension and may induce detrusor fatigue temporarily. Consequently, voiding detrusor pressure decreased, resulting Qmax decreased and PVR increased. It has been reported that Destruction stricture dysfunction might induce volume statistical curve. Therefore, it is possible that overfilled bladder might induce DSD in some cases. Compared to children with no urethral stricture, Qmax decreased, VT prolonged, and PVR increased significantly in children with urethral stricture regardless of bladder distension or not. This might indicate that uroflowmetry and PVR measurement is a sensitive tool for evaluating the urethral stricture induced by surgery. However, interpretation of results in these cases must be careful, due to uroflowmetry and PVR measurement is usually affected by overfilled bladder. So this is our conclusion. Uroflowmetry and PVR is a sensitive tool providing objective evidence for urethral structure diagnosis in children after hypospadias operation. However, overfilled bladder affects the results of Qmax, VT, PVR, and uroflow curve partial significantly, suggesting that patients should not be encouraged to overfill the bladder at the time of uroflowmetry and PVR measurement. That's all. Thank you.